Actor James Van Der Beek died yesterday of colorectal cancer. And I wanted to talk to my brother, who is a renowned cancer surgeon, has done enormous research in the area of colorectal cancer, about his life, his legacy, and what early detection means for all of us. So thank you, Anton. I know you are incredibly busy, but help us understand why he only identified the cancer when it was already stage 3. Could he not have had it detected earlier?
Well, hi, Nad, and I think this conversation is very timely. We are seeing an epidemic of early onset colorectal cancer. Colorectal cancer used to be an older person's disease. Most people that we saw in the clinic were over age 65. Now, the majority of patients that we're seeing is under age 50. It's hard to imagine that colorectal cancer is now the leading cause of death in males under age 40 and certainly under age 50, and the second leading cause of death in women under age 40, soon to be the leading cause of cancer-related deaths in women as well by the year 2030. So what we're seeing is unprecedented. And the known risk factors, obesity, bad diet, family history, really apply to the minority of patients. Most of the people that we're seeing in the clinic, and I'm seeing a younger person with colon cancer or colorectal cancer every week, don't have those symptoms. They're young, they're healthy, and the obvious question is why? What is the cause? What are we learning about early onset colorectal cancer? And this is an area of special interest of mine and has been for the last few years, and something that we've published on because it is so important. And the second, and this gets to your question, is what should young people be doing to prevent getting colon cancer? Because up to 70% of colorectal cancer is completely preventable. So let's start in the beginning, as far as the possible causes and what we're seeing more and more in the literature. There's a lot right now about processed food, ultra processed food, eating preservatives, food that's too fatty, meat that is overcharred. So we're learning a lot about a link between diet and quite frankly, processed food exists in just about everything. You may think that you're eating something healthy, but if the food that you're eating doesn't have some preservative in it, it's unlikely to be on a shelf for more than a day or two. So preservatives are everywhere, and processed food is everywhere. So just want to be clear about how common that is, and how recent data and recent research is showing more of a link between what we're eating and colorectal cancer. And the clock might start ticking at a very young age. So to your listeners, it's not just about people age 40 or 45 and what they can do. It's what perhaps kids should be doing. Staying away from vending machines, eating fruits and vegetables, being very aware that maybe the clock starts ticking at a much younger age. The other theory is the overuse of antibiotics. Our body has trillions of bacteria known as the microbiome. Microbiome is enormously important in protection against cancer, against heart disease, important in the immune system. And by neutralizing those good bacteria, that too may play a role. So that has been looked at, and there are studies that have come out of the UK that have shown that there's a higher incidence of colorectal cancer in younger people that have overutilized antibiotics at a younger age. So a lot of research going on in this space right now, because we are encountering something that really we have not seen before in the cancer world. As far as prevention, the standard prevention is colonoscopy. And once the country realized that we're seeing younger and younger patients with colorectal cancer, they reduced the screening age. The screening age used to be age 50, and they reduced the screening age to age 45, the United States Preventative Task Force, back in March of 21. Now, when that happens, it means that all insurance companies are required to approve colonoscopies at age 45, just even in anyone without symptoms. Because if you get a colonoscopy and you find a precancerous polyp and that can be removed, you're preventing colon cancer, or you're detecting colon cancer at a very, very early treatable stage. So go ahead. You're on mute, Nat.
It's 2023 when Van der Beek says he notices unusual bowel movements and only then goes and sees a doctor. By then, he's already got stage 3. I mean, right. We're just trying to understand that somebody who looks so healthy, looks athletic, as you say, is not overweight. Why wait? And how could he have prevented or gone to a doctor sooner?
Right, and so this is something that we're looking at, and we've got several ongoing studies. The so-called red flag symptoms. This is what younger people need to be aware of, and not just younger people, also primary care doctors, because a lot of people have hemorrhoids, for example, and they have a little bit of bleeding, and they go to their primary care doctor, and most times the primary care doctor will say, "Oh, you've got hemorrhoids, you've got some bleeding, don't worry about it." Well, now you need to worry about it. If you're having rectal bleeding, for example, at a young age in your 30s, because remember, the screening guidelines are age 45, but we're seeing people in their 20s and their 30s. So you're not going to routinely screen those people. So if someone in their 20s or 30s is having rectal bleeding that is not going away, then it warrants a further workup. It warrants perhaps a colonoscopy. Unexplained weight loss, change in bowel movements, just change in bowel habits, stomach discomfort. There are many symptoms, and the other, if a young person goes to their doctor and they've got some rectal bleeding, and the doctor does a blood test, and their hemoglobin is low. In other words, their blood count is low. Again, one cannot ignore that. And again, so we have to not only educate younger people in their 20s and 30s about the symptoms I just mentioned to you. Cannot ignore those symptoms. But our primary care doctors also have to be very aware that we are now dealing with a young person's disease and not just attribute some rectal bleeding, for example, to hemorrhoids and a hemorrhoid cream.
When you heard that this young man, high profile, yes, had died at 48, I'm just curious we haven't had a chance to discuss this. So again, and you're sharing just some excellent information with us, and you heard only identified at stage 3. When someone comes to you and it's stage 3, is it always terminal?
No, not at all. And I think that's something to be very aware of, is that if you're diagnosed with stage 3 or stage 4, you still are curable up to 40%. So stage 4 means it's spread to other organs, such as the liver and the lungs. Stage 3 means that it's gone beyond the colon to surrounding lymph nodes. The treatment for both stage 3 and stage 4 often combines a combination of surgery, chemotherapy, and now there's some newer treatments looking at immunotherapy. So we are curing up to 50% of patients with stage 4 colorectal cancer. I think there's a lot that we don't know about, his cause of death and when he presented and how long he had it for. There's a lot we don't know, but you have to assume that if he was diagnosed with stage 3, he likely didn't die from stage 3 colon cancer. he likely was treated for it and it progressed to become stage 4. And then because typically you die from stage 4, not from stage 3. But if you have stage 3, that probably means that he had a polyp that was turning bad more than 10, 15 years ago. Because if you look at the progression over time, and that's again why colonoscopy saves lives. And it's not just a colonoscopy, there are other screening tests such as Cologuard, which is a stool test for DNA, which is very sensitive. So there are other ways to screen for colon cancer, but that's that's the length of time. You don't just suddenly show up with nothing in your colon and then stage 3 colon cancer a couple of weeks later. So this has been there for a long time. Hence the importance of being aware of red flag symptoms and going to your doctor if something doesn't seem right and persisting.
I think this is such a good way of really paying tribute to Van der Beek, because he was an avid protagonist for early screening. He was very open about it. He was very transparent. I've been seeing lots of TikTok videos with him talking to people about get early screening. He really was an advocate for what you're saying.
And but was he an advocate after he became diagnosed?
It sounds like he was an advocate after he became diagnosed, which is very brave.
Correct. And that's what I think happens with a lot of people that can have an impact on others, is when they are diagnosed with something that is preventable. It is very brave to go public. A lot of actors or well-known individuals prefer to keep these things very private, and
because it may impact their careers.
Sure, absolutely. So I think he should be applauded for being vocal about it, and if one life can be saved, that would be terrific.
Well, that's what we hope to do today. So in honor of James Van der Beek, 48 years old, husband, father of 6 children, to my brother, Dr. Anton Bilchik, thank you so much. I know I'm going to let you have the last word on this, because it is always upsetting, always disturbing when you hear of anybody dying so young and of something that maybe could have been prevented. So I give you the last word, and I know you have a surgery to go to, so I'll let you have the last word. And Anton and I really do try and bring you great advice, guidance on living long, living strong, and living healthy. So final words with you.
Firstly, deep condolences to James and his family. Secondly, colon cancer is now a young person's disease. Third, up to 70% is preventable. 4, pay attention to your body. If something doesn't seem right, go see your doctor and get worked up, so that you're not in a position where once you're diagnosed, it's more advanced.
Thank you so much to my brother, cancer surgeon, Dr. Anton Bilchik, and hopefully our next conversation will be on certainly a more positive subject. Thank you so much.
Thanks.